Hello and welcome, everyone. Thank you for joining us for this COVID-19 telephone town hall with the Tri-County Health Department and the counties of Adams, Arapahoe, and Douglas. If you'd like to ask a question, simply hit *3 on your telephone keypad, and an operator will come and take your question. Now, if you're listening online, you can type your question into the question box on the website. My name is Dirk, and I'll be your moderator tonight. Now, we'll be providing an update on Colorado's COVID-19 vaccination rollout and distribution plans in our 3 counties. The state is receiving limited allocations of 2 FDA-approved vaccines, with a couple more promising ones in the pipeline. Tonight, we'll also give you a status update on COVID case numbers in the Tri-County area, and we'll answer your questions about the vaccines and when and where you should expect to get them. Now, given that this is part of a nationwide vaccination effort, as you might imagine, this is a very complex undertaking. There's also a lot of information about vaccines swirling around that can be confusing at times. That's why we want to get to your most pressing questions as quickly as possible. We have a lot of ground to cover tonight, and we'll focus most of our time with representatives from Tri-County Health. But first, to kick things off, let's welcome Arapahoe County Commissioner and Board Chair, Nancy Jackson. Hello, Nancy. Are you muted? Ms. Jackson. As we wait for Commissioner Nancy Jackson, let's go ahead and move on to Commissioner Laura Thomas.
Thank you, Dirk. I'd like to thank everybody for listening this evening and joining us. We're also pleased that these vaccinations are starting to become available. Given the volume of people involved in all aspects of this process, coordination and clarity of information will be crucial in making sure that these vaccines get distributed whenever a new phase category is called. That's why we've invited Tri-County Health officials to walk us through this really important process today. And with that, I'd like to turn this over to Adams County Commissioner Eva Henry.
Thank you, Commissioner. Hello, I'm Commissioner Eva Henry with Adams County. Thank you for joining us tonight. There are many factors and processes that determine who should get these vaccines and when, and we are here tonight to share the latest information we have. We are all in this together, and as mentioned a moment ago, coordinations with all 3 counties and Tri-County Health Department is crucial to get you the most accurate information as soon as possible. We welcome your questions and will do our best to be as specific as possible about the situation. And now I'll turn it over to our moderator.
Thank you very much, Commissioner. And let's see if we have Board Chair Nancy Jackson back. Nancy, are you back with us? I'm guessing not. We're having some technical difficulties, but I certainly wish to keep moving forward since we do have a lot of ground to cover. As soon as we have Nancy Jackson back on with us, we'll get her into the discussion and conversation. But I do thank the 2 commissioners for setting the stage for tonight's discussion. And a quick reminder, if you'd like to ask a question, simply press *3 on your telephone keypad to get connected to one of our operators. Now, let's go ahead and bring on Dr. Bernadette Albanese with the Tri-County Health Department to give us an update on the current COVID status in the Tri-County area. Doctor?
Hi, good evening, everybody, and welcome to our town hall. Great to be with all of you tonight. I'm going to keep my comments very brief tonight because I'm anticipating we have a whole lot of questions coming about our vaccination situation. So I just want to share, I think, what is good news about where things stand with our case counts in all of our 3 counties. We are seeing very encouraging trends, especially over the past couple of weeks. where the number of cases of COVID in all three of our counties continues to trend down. Our 2-week trends are down about 14-15% in all three of our counties, which is a great sign. The percentage of people testing positive for COVID is hovering between 5 and 6%. Also a good number to see. Our hospitalizations for COVID disease are coming down. So these are all very, very good trends. And please stay the course with your disease control measures. To help keep these numbers suppressed and keep them down, please wear your mask and pay attention to social distancing and limit your interactions out of the household, because all of those measures are helping us get good numbers. I am going to give a little bit of information about where our vaccination status stands. I'm going to give you some numbers for Colorado and then for our 3 counties in Adams, Arapahoe, and Douglas. So information we have from our state health department today shows that about almost 700,000 individuals have received a COVID vaccine so far. About 495,000 have gotten 1 dose of the 2 vaccines available, and about 162,000 have received their full 2 doses. In the Tri-County area, we have just about 97,000 individuals who have received their 1 dose of the vaccine, and about 34,000 that have received 2 doses. So you know what? This is encouraging news. We have a long way to go, and we'll be talking about that tonight. We have a long way to go, but we are making slow and steady progress. But again, let's stay the course together, and we are going to get through this. So that's all I have for right now till our questions come in. Thank you.
Thank you very much, Doctor. And we are queuing up some questions right now. And if you are on the line with us and have a question you'd like to ask, please press *3 on your telephone keypad. And now I'd like to invite Meredith Brown, Tri-County's Nurse Supervisor for COVID-19 vaccine planning, to walk us through the specifics of the vaccination distribution process. Welcome to the call, Ms. Brown.
Thank you so much. As you may know, Colorado is using a phased approach to vaccination. Last Friday, the governor announced an updated Colorado vaccine distribution plan, which now includes phases 1B.1, 1B.2, and 1B.3. In this announcement, he stated that those in phase 1B.2 would be eligible to be vaccinated beginning February 8th. That phase 1B.2 includes Coloradans age 65 to 69, pre-K through 12 educators, and child care workers in licensed child care programs. I want to emphasize that the goal in Colorado continues to be to vaccinate at least 70% of Coloradans 70 and older by February 28th. So we are still prioritizing those groups 70 and older. We are getting more vaccine allocated in our state, including this week 90,000 doses for the state and about 19,000 doses in Adams, Arapahoe, and Douglas counties. It's not quite enough to vaccinate everyone that's eligible and wants to be vaccinated. So we are working through all of our eligible groups while still prioritizing those 70 and older. And I also want to mention that all this information can be found on our website, tchd.org, by clicking on the COVID banner at the top of the page. And I'm excited to take other questions about this process as well.
Thank you so much, Meredith and Dr. Albanese. That was a lot of information. I would like to start with some questions. So if you haven't already, you can dial *3 on your telephone keypad to be connected to an operator. And we've got a caller, Peggy from Douglas County, joining us right now. And it looks like, Meredith, this is a good question for you. Peggy, you're live. Go ahead with your question, please.
Thank you very much. Hi, Meredith. My question is, with Governor Polis rolling out the 1B.2 as of last week to begin February 8th, my husband's 74. He's on 6 different lists to receive the vaccine. Right now, he's 93,000, or number 93,000 with Kaiser. And my question is, with this additional group that's being added, doesn't that just basically push anyone in the 70 and older category further down the list by adding to the pool of people that would be randomly eligible for a vaccine?
Thank you, Peggy, for that question. I would emphasize that vaccine providers are still prioritizing people 70 and older, and that is the direction from the governor. The state announces these additional guidelines and eligibility a little bit ahead of time so that we're preventing any lag time between phases. So we would not want to get close to vaccinating all of the 70 folks in that 70 plus group and have, any time in between vaccinating eligible groups. And so we add that group to prevent that lag time, assuring vaccine gets into arms as soon as we receive it. But I can assure you that vaccine providers have been instructed to continue to prioritize folks in that 70 plus group.
Thank you very much. Moving on, we've got Bobby joining us from Arapahoe County, and this one looks like a good question for Dr. Albanese. Bobby, you're live. Go ahead, please.
Thank you. Can you hear me?
Yes, ma'am.
Okay. Two things. I thought of another one after I left my question. I'm immune suppressed, and I'm wondering, and I'm in 1B3. I'm wondering, will we still be getting the Pfizer and Moderna vaccines when we get to that group? And because my immune system doesn't work very well, I'm wondering, should I turn down anything that's not 95% effective? I know I need to ask my doctor that, but will they come back around to me, or will I be making a mistake if I turn it down? And then the other question is, my home health nurse yesterday told me that people that were immune suppressed, if you had multiple comorbidities, were allowed to get the vaccine now. Is that true, or did she misunderstand something?
Hi, Bobby. Thank you so much for your question. Let me answer your second question first. So I think your home aide might have misinterpreted the phases that have been set up for Colorado. So you are correct. You are at the moment you are qualifying for phase 1B3. So when we move through trying to reach our targets for our 70 plus, and then our 65 to 69, and then our school educators, then we will be in that group. And so there isn't anything else about moving around outside of that. In terms of your question about choices of vaccine, it's a great question. I think my short answer will be to take advantage of the vaccine that can be offered to you. The data that we're getting from the vaccine manufacturers is the first phase of finishing up their clinical trials in order to be able to get approval from the FDA for us to be using the vaccine for the pandemic response. And as expected, there is going to be some differentiation in the level of effectiveness of the vaccine, but they're all quite good numbers. I mean, I know you say, well, 95% is a little bit lower than 70% or 75%, but remember those numbers represent the amount of risk that is reduced in getting sick with COVID disease by being vaccinated compared to being unvaccinated. So whether you have a 90% reduction in risk in getting sick from COVID from one vaccine, or a 75% reduction in risk in getting sick from a different COVID vaccine, they're all very good numbers, and they're all going to work hard to keep you protected. So I think, again, you mentioned speaking with your doctor about it. I think that's great advice for yourself, and I echo that. But I think all of the vaccines are going to give us good choices. Thank you.
Thank you very much, Doctor. And next, we've got an online question, and I think this is a good one for Meredith Brown with Tri-County. And Donna asks, are people supposed to sign up at multiple provider sites?
Thank you, Donna. As Dr. Albanese said, we do want everyone to take advantage of vaccine that's offered to you. I think it is okay to sign up at multiple sites. I would emphasize again that the vaccine supply is very limited at this time, so we understand that even for those groups that are eligible now, it is very challenging to get an appointment. So it may be helpful to sign up at multiple sites. It's important to know that once your appointment is made, it's important to go to your appointment and get your vaccine when it's available. And then if you do, receive a call from another provider, to make sure that any other appointments are canceled so that we're not taking those appointments away from other folks. But our vaccine providers are using and administering the vaccine to people as soon as they receive it. And so if you are signed up at multiple sites, that may be another option to get other calls and just go ahead and take that appointment and then, cancel any other appointments that may come up. Thank you.
Thank you, Meredith. Stay where you are. Our next caller's got a question for you. And our next caller is Mary Ann. She's joining us from Thornton. Mary Ann, welcome to the call. Go ahead with your question, please.
Thank you. My question is, my husband is 74 years old, so he definitely can get the shot right now or sign up for it. But he's totally disabled. He can't do anything by himself. He can't eat by himself, dress himself, whatever. I'm his 100% caretaker. And my question is, he can get the shot, but I can't because I'm only 61. And my question is, if I would get COVID and get sick and end up in the hospital, there's nobody to care for him. There's no family, nobody that can care for him. And so I'm wondering if there is a way that I, as his 100% caregiver and his spouse, can get the shot around the same time he does, because this is crucial for our life here in our home. So that's my question. I don't know if there's a possibility.
Thank you, Marianne, for that question. We are happy to hear that your husband will be eligible for the vaccine. At this time, caregivers in the home are not on the phases from the governor, and so you would not be eligible as a caregiver. I do agree that it's very important and that you are able to get your vaccine when you are eligible, but based on the phases that the governor has released on Friday, we know that caregivers are not eligible for the vaccine at the same time as the person that they are providing care for.
All right, our next question looks like it's for Dr. Albanese. We've got Diana joining us on the line. Diana, welcome to the call. You are live. Go ahead with your question, please.
Hi, I am 74, and I just wondered, since I had a bad allergic reaction to a flu vaccine, would you recommend that I have this vaccine for the COVID? And also, I wanted to ask, is there another way of getting the vaccine besides a shot? Somebody told me something about a spray that you can spray through your nose, or they're working on some kind of spray that can work for a vaccine also. I don't know if that's true.
Hi, Diana. Thanks for your question. Yeah, let me get that one out of the way. So that spray sounds a lot like a flu shot. So the two vaccines that we currently have approved for use in the United States are injections, and the next couple of ones coming down the pike are also injections. So I'm not aware of any spray-type vaccine coming down the pike. You are in a tricky situation because your allergy reaction, without getting into too many details, to the flu vaccine comes in as a precaution to receive a COVID-19 vaccine. So anybody who has had a significant allergic reaction to a vaccine or another injectable medication therapy is placed in a precautionary category. So I would suggest that you have a conversation with your provider to weigh the risks and benefits. The risks are the unknown risks that you might also have an allergic reaction to a COVID vaccine injection, and that possibility is there, versus the risk of you not receiving a COVID vaccine at all. So it's not an absolute contraindication, meaning saying, there's no way, impossible for you to get a vaccine. It's a precaution. So please speak with your provider and talk about those risks and benefits between kind of the unknown and whether you might react to the to the flu vaccine, and that's in part dependent on the type of reaction that you had to the flu vaccine versus your risk for COVID. And with your age, that is something to take into consideration. Thank you.
All right, moving on, we've got Denise from Littleton joining us, and Meredith, looks like a good question for you. You're live. Go ahead with your question, please.
Hi, thank you for taking my question. I've been hearing for months that Hispanic and Black Americans have more COVID hospitalizations and deaths within the population. Why have they not been prioritized in the vaccine upper tier schedule? What's the reason for CDC reporting this? The numbers are there.
Hi, Denise. Thank you for that question. That's a very important one. And right now, the phases that we're using in Colorado are based on the level of risk for each individual, which is why we've started with that 70 plus and then moved to 65 to 69 as they also have elevated risk. And Tri-County as well as the state of Colorado are focusing a lot of our vaccine efforts on vaccine equity. We have an equity officer and an equity work group as part of our response to make sure that we're reaching all members of the community, including those in underserved populations and also rural areas where we know access to care is more limited and that those groups tend to have worse outcomes from the vaccine. I can't speak exactly to the decisions made for each individual phase. However, this issue of equity is very much on the minds of all of us at Tri-County as well as in the state. And it's very important to us that the vaccine rollout is equitable to these groups that, as you mentioned, have been disproportionately affected by COVID-19. Thank you.
Thank you very much, Meredith. Stay there. Our next question comes from online. Anna writes, is Tri-County planning to have a large-scale vaccination site such as the Douglas County Fairgrounds?
Hi, Anna. That's a great question. Right now, given the very limited quantity of vaccine, we are working to make sure that vaccine is sort of spread out throughout providers. And that also sort of answers some of that equity question because we want to make sure that it's accessible to everyone. And so having vaccine go to many, many different providers is more accessible for many of our folks who might have transportation struggles, that they have, a place in their neighborhood that is closer. There may be a time in the future where we may have large-scale vaccination opportunities. But right now, just given the very limited vaccine quantity, as well as the kind of small, very specific groups that the vaccine is available for, we are not working on those. We don't have any of those planned right now. However, we are working with our partners so that if vaccine supply drastically increases and we have that appears to be the best opportunity, we do have those plans in place so that we could have those large-scale vaccination clinics. Thank you.
All right, moving on. Meredith, another one's coming your way. We've got Kyle joining us from North Glen. Kyle, welcome to the call. Go ahead with your question.
Yes, my mom is 87. She's a survivor of colon cancer. My brother is 63. He's got Alzheimer's and dementia. I am 61. I have a collapsed lung. Sorry about my breathing. And then I got Alzheimer's and they got dementia too. So, but I was wondering if there's a time when all three of us could be eligible for the virus where we could take it at the same time. And also, I wondered if you could do something with maybe like Access Ride where they could vaccinate people at home that are like us, where there's 3 or 4 of us, and we're, if we vaccinated those people, that we have caregivers, but not vaccinate the caregiver, but vaccinate the people that are 3, 4 people in the home that have serious conditions. That could be done with like Access Ride or somebody helping deliver nurses here.
Yeah, thank you, Kyle, for that question. I would agree with you. It sounds like your family has a lot of risk factors for COVID-19 and for complication of COVID-19. Right now it's really important for us to follow the phases that the governor has set out, and really that comes down to vaccinating folks that are at the highest risk. So, as you mentioned, your mother being 87 would certainly be at the highest risk, and then they are taking into account some of those health conditions for folks and putting them sort of in the upper phases. Right now, we are working on plans for reaching those folks who are in their homes and have serious difficulties getting to a vaccination appointment or a vaccination site. And so we are working through that. Many people may have heard, this vaccine has to be kept at specific temperatures. And so it is complicated to move it around. But we are absolutely aware that there are folks at home that are eligible for the vaccine and will be eligible in later phases. And so we are working on plans for that as well. Thank you.
So Meredith, we're keeping you in the spotlight. You've got the next question as well. We've got Joanne from Parker joining us live on the call right now. Joanne, welcome. Go ahead with your question, please.
Oh, yes, thank you for taking my call. My question is for people like me who are family child care home providers. And so when we read through the information, it indicated for, like schools to work with their administration to then centralize that effort for vaccinating that particular school population, but then no mention for just sort of sole proprietors who are also in that group to be vaccinated. So the question is, will there be sort of a centralized advocate for that population of family care providers?
Thank you, Joanne. Yes, for those licensed child care providers, we are working right now for both schools and child cares to understand what the capacity is in the community for those groups to be vaccinated. And so we anticipate that we will be able to identify some specific providers that will be accessible to those groups, so that if you don't have, an employer per se, someone that you report to, that you will be able to coordinate that. And we will post that information on our website. We also have some specific communications that go out to our child care providers. And so please reach out to us. You can give us a call at our call center, which the number for that is 303-220-9200 if you need to be added to those communications to child care providers. But we will be posting information as we understand the capacity in the community for those educators who don't have that sort of employer connection to be connected with a vaccine provider. Thank you.
All right, let's get another caller here. We've got Tori joining us from Arapahoe County. Tori, welcome to the call. It looks like you've got a question for Meredith. Go right ahead, please.
Hi, Meredith. Thanks for taking my call. I'm an essential transportation employee, so I can't work from home. I've been wasting 2-3 hours a day going through all these different signups. Why isn't Arapahoe County, or Tri-County, doing a better job of collecting data? Why are you using Sign Up Genius? That's what our PTOs use for bake sales. And how long am I going to have to keep shopping online to find an appointment?
Hi, Tori. Thank you for that question. We are moving to a new scheduling system. And so I understand that there were some frustrations with that Sign Up Genius system, but we are moving to a new scheduling system that can collect a little bit more information from folks. And as I said, unfortunately, the vaccine supply is very limited at this time. And so we are adding appointments as frequently as vaccine supply and capacity allows. But unfortunately, we are restricted right now by the limited vaccine supply in the community. Thank you.
All right, next we've got an online question. This was submitted by Castle, who asks, how would a retired registered nurse volunteer to assist with giving vaccines? Meredith?
Yes. For individuals who are able to administer vaccine and interested in doing so, if they're interested in volunteering with us at Tri-County, we have a post on our careers page where people can apply. So if you go to our website, tchd.org, go to the How Do I tab and click on Careers, you'll be able to see that posting and apply, and then our staff will reach out to you if it is a good fit. Thank you.
Wonderful. Let's get back to callers now. And Meredith, this one's coming at you as well. It's Cheryl who joins us from Adams County. Cheryl, welcome to the call. Go ahead with your question, please.
Hi. My question is, I fall into the group that it's down the pipe, but it's when you have multiple high-risk conditions. And do I go to my doctor to get documentation, or how do I go about getting notified when I can get the vaccine, since I have 2 or more high-risk conditions?
Thank you, Cheryl, for that question. In terms of being notified when you'll be eligible for the vaccine, I would encourage you to check in on our website, on the State Health Department website, and we will be posting updates there in terms of where in the phases we are at this time. We don't know exactly what the documentation will look like for folks with those chronic conditions. However, it's a good idea right now, before you're eligible, to speak with your doctor, talk about your specific situation, and see what kind of documentation they can provide, so that if that is needed when you're eligible for the vaccine, you have that ready. You've already had that conversation with your doctor, and you can go ahead and sign up. Thank you.
All right, Meredith, I'll give you a quick break to grab a little bit of water, and I will let everybody on the call know that if for some reason we don't get to your question tonight, you can always call the Tri-County Call Center at 303-220-9200. Again, you can call the Tri-County Call Center at 303-220-9200. Now, we'll go ahead and get back into calls. We've got Robert from Aurora joining us now with a question for you, Meredith. Robert, go ahead, please. Hello, Robert. We've disconnected from Robert. We'll try and get him back. Moving on, we've got Maura now from Highlands Ranch with a question for the doctor. Go ahead, Maura. You're live.
Oh, hi there. I just wanted to know, does anyone have any data on how long the protection from the vaccine will last? Is it a one and done, or will it be like a flu shot annually? Does anyone know how long the protection lasts?
Hi, Maura. Great question. Thank you. The answer is that data is being accumulated as we speak. For the 2 COVID vaccines, the Pfizer and the Moderna product available now, those clinical studies that evaluated how well the vaccine worked and safety and so forth will run beginning over the summer and into the fall. And so that's kind of our starting point of measuring the duration of immunity, so how long your immune protection lasts up to this point. For several months then into that work with those individuals who received those first doses. There aren't any indications that the immunity is wearing off, but I think we're going to learn more as time goes on. So those individuals that participated in those clinical studies are anticipated to be followed for a couple of years. But I think, we'll know a little bit more later this spring. We'll know even more later this summer and again later this year. But thus far, several months into monitoring those people and measuring their immune response, it's still looking good. So we don't have any information about whether you need a booster yet. So time will tell. Thank you.
Thank you very much, Dr. Albanese with Tri-County Health. Got Shirley from Arapahoe County joining us now with a question for Meredith. Shirley, welcome. What's your question?
Hi, thank you. I think you've answered a couple of questions, but I have one. I heard 19,000 potential vaccine shots. And I just need to know, for Tri-County Health, I just need to know how many days does that entail and how many locations in Tri-County Health.
Hi, Shirley. So I want to clarify that the all of the providers within Adams, Arapahoe, and Douglas counties received 19,000 doses this week. So it was not just that Tri-County clinics received those doses. Those went to all of our providers, including our hospitals, pharmacies, community health sites. Those, and as well as our Tri-County clinics, received those doses this week.
Perfect. Thank you very much. Now we'd like to pause the questions for just a moment to hear from Dana Malik and Caitlin Lucarello from the Pharmaceutical Research and Manufacturers of America. Ladies?
Thank you so much. This is Dana Malik. I am a Deputy Vice President of State Advocacy for Pharma, and I just am so grateful to be here with all of you. Thank you for such great questions. I'm going to be brief and then hand it over to my colleague, Caitlin Lucarello, but I just wanted to kind of talk through some research that Pharma has done. We're the trade association for some brand pharmaceutical companies in the United States, one of which got a vaccine across the finish line, Pfizer, and two of which are going to be close behind, J&J and AstraZeneca. And so, as a trade association, we started looking into maybe some of the challenges we were going to have with vaccine confidence. And so I just wanted to share with you some of the treetops of what our research showed, and then give you some tools to leave behind of some messages and some data and information that might be helpful to you personally or to those in your life that are hesitant or kind of have a lower level of confidence in the vaccine, be it for safety reasons or other reasons. So just quickly, as we kind of did some polling and focus groups on this issue, we really learned that people were most concerned about the speed at which these vaccines were approved, the novelty of the COVID-19 virus, how much do we know about it? It's only been around for a short period of time. And then people were concerned about side effects too, and the things that we just don't know yet because of the short amount of time that we have been exposed to the virus and the interventions as well. And so what we really did is kind of try to drill down into those basic concerns that folks had. And we've compiled just sort of a list of things that have really helped to share with people to move them to a place of higher confidence in the vaccine safety and really kind of get at some of the questions they had that are more, kind of scientific in nature about concerns with speed and side effects. So just very quickly, we've got some information that kind of allows some reinforcement that vaccines do save millions of lives, for example, thinking about smallpox and measles. We've got some points that really sort of emphasize the vaccine development and testing process as one that was quite rigorous and one that did not cut any corners and in fact was in a lot of ways had added layers of scrutiny in the case of the two COVID vaccines that have now been approved. And then we also have some points to make around just underscoring the massive scope of the clinical trials that were undertaken to get these vaccines across the finish line. Tens of thousands of people were included. And so people really want to know more information about kind of who was included, what different groups and demographics were included, just to, to ensure that those from all walks of life were tested in the trials. And then people are definitely looking, obviously, to hear from medical professionals and experts on this subject. And it's so fortunate that we have these great medical experts and voices here today. So I will stop there and hand it over to my colleague, but I will be able to send through, and hopefully all of you will be able to access sort of a toolkit that we've developed that really does talk through some of the most common points of concern that folks have with the vaccines. And hopefully these additional pieces of data and information will be helpful in conversations you have with your community and colleagues and families, but also will help to ease concerns that you may have yourself about the vaccines as well. So with that, I'll hand it over to Caitlin Lucarello to talk a little bit more about where we are with the vaccines that have crossed the finish line or are about to. Go ahead, Caitlin.
Thanks so much, Dana. Hi, everyone. This is Caitlin Lucarello. I'm the Director of State Policy here in Denver for the Pharmaceutical Research Manufacturers of America, or PhRMA. It's exciting news that we're here talking tonight about this, and I think, just want to underscore that in less than a year's time, we have 2 vaccines for COVID-19 approved for distribution through emergency use authorization by the FDA. Those are Pfizer and Moderna's vaccines, which I'm sure most of you on the call are becoming very familiar with. Both of those are mRNA vaccines, and they're going to work a little bit differently than your traditional vaccines. They don't use a weakened or inactive or viral vector to produce the immune response. Instead, these vaccines use something called messenger RNA, or mRNA, to give your cells the information that they need to then produce this immune response for COVID-19. And then soon after your cell is finished using those instructions, it breaks down and gets rid of that mRNA. These vaccines offer a real advantage in that they require a lot less of the amount of vaccine for manufacturing. So they're much faster to manufacture than our traditional vaccines. And as we've seen, they're both highly effective. But they do need really super cold storage temps, and you also need 2 doses of these vaccines to get the full benefit of the immune response. I'm sure that most of you saw that Johnson & Johnson applied for emergency use authorization with the FDA today, and AstraZeneca will be shortly following behind. So we may get emergency use authorization from the FDA in the next few weeks or so on those vaccines. They're both a viral vector technology, and those are the same as you see with our typical hepatitis B vaccine, HPV, or maybe some of you have had the shingles vaccine. They're all 1 dose, and the advantage to these is, in addition to being 1 dose, they don't have special storage requirements beyond what we kind of see for our typical flu vaccine. So that can help with some of these distribution issues in some of the tougher places. And we expect that we'll probably see Johnson & Johnson and AstraZeneca's vaccines, if all goes according to plan, on the market and available for distribution in late spring or early summer. Although, it is extremely exciting that we have these vaccines on the market and we've been able to bring them to market as quickly as we have, I do want to underscore what Dana said, that it was certainly not at the expense of safety. They were subject to a very rigorous clinical trial process and continue to be. And once a vaccine is brought to market, now or any time, we, the manufacturers, work with the FDA to do post-marketing surveillance and ensure that we're seeing the results we would expect to see and the ongoing safety of the vaccine once it's available to the public. That being said, I just wanted to answer one of the questions from folks on the phone. I see actually a couple people have asked if they can choose between the vaccines that might be available on the market. And right now, you won't be able to choose which vaccine is available. It'll be what's available and stocked at the provider location you go to when you have an appointment for your vaccine. I realize that people have some hesitation, and we all would like to have the 95% effective vaccine. But if we can get folks vaccinated, even if a vaccine is effective in the high 70s, we can really achieve that herd immunity that we need and be more successful at controlling future strains or mutations of the disease as well. So encourage folks to get the vaccine regardless of which one is available at their provider when they do so. And happy to answer any more questions. Thank you all so much for having me, Dana, tonight.
Thank you very much for that information, Caitlin and Dana. And we'll get to calls in just a second. I do want to remind everybody there are 2 places where you can find up-to-date information on COVID-19 transmission and safety practices. The first is the Tri-County Health Department website. It's easy to find at tchd.org. Again, the Tri-County Health Department website, tchd.org. And when you get there, you'll see a banner at the top of the website that will take you to the COVID section. Now, the second website is the state's COVID site. You can find that at covid19.colorado.gov. Again, covid19.colorado.gov. Now let's go ahead and get back to a few more questions. We've got Brian with a question for Dr. Albanese. Brian, you're in Thornton. Welcome to the call. Go ahead with your question.
Hi, doctor. I'm 55. I'm a COVID survivor from November, and I'm just curious about the risk factors for myself. My wife is a nurse over at Good Samaritan Hospital, and she has been asked to go and do some injections on Saturday morning at the Denver fairgrounds. I forget what they're called completely, but I'm wondering about the risk factors for that versus me, and also because I'm surviving COVID, am I higher risk, or am I still someone when it gets down to the 55 and above level? Am I still needing to get the vaccine? I'm just curious about all that.
Hi, Brian. Thanks for your question. There shouldn't be any risk with your wife going to get her vaccine wherever she gets it. We have lots and lots of appropriate precautions in place for anyone coming to a clinic to get a vaccine. So I misunderstood your question, but it didn't sound like there was any issues. In regards to it, so if you have had COVID in the past, yes, you can get a COVID vaccine. So the CDC has not made any recommendations to say someone who had COVID before should, not get the vaccine. So you can receive the vaccine if you choose to do so. Some qualifiers to that. So we don't want anyone coming to a vaccine clinic who is supposed to be in isolation. So if you are sick with COVID or you've had a recent positive test and you've been instructed, to stay at home for your observation period, you should not be going out and about into someone's office or into a public setting to get a vaccine. You're supposed to be staying home. So that's either whether you've been recently exposed to COVID or whether you're actually actively suffering from COVID infection. So we don't want sick people or people who might be at risk to being actively infected with COVID to be showing up in these sites. You just have to wait until your observation period, your quarantine period passes before you would get out and about. People who have, so the data that we have thus far, so if you've recovered from COVID infection, you have some immunity on board already, which is maybe one of the only benefits of having had COVID infection. And we think that immunity lasts for at least 3 months, probably longer than that. There may not be any immediate urgency for someone who's recovered from COVID infection to immediately go back out and seek vaccine. You have time to wait, and I think it's a choice of yours or a choice that you can make with your healthcare provider on when might be a good time to seek vaccine. Other than that, you're not in any particular prioritized category as a COVID survivor. So your eligibility for the vaccine would be not associated with your COVID diagnosis, but based on your age, based on your conditions, health conditions, based on the type of work that you do, so on and so forth, all of the other categories that we've been talking about tonight for prioritization. So you'd have to look at the, at the state's phases and see where you would fit in minus your COVID diagnosis to see when your eligibility would come up. Thank you.
Thank you very much, Doctor. And next up, we've got Karen from unincorporated Adams County joining us on the line with a good question for Meredith Brown with Tri-County. Go ahead, Karen, with your question, please.
Yes, I was fortunate enough to get the first vaccine, but I got it because somebody didn't show up and they called me, and I went right down and got my first vaccine shot. And I'm scheduled for a second vaccine shot, but with all the information about them not having enough vaccine, I'm wondering if I should be trying to schedule another appointment for the second vaccine, or if I just go back to the first place and get the second vaccine, and I'm assured that I will get the vaccine there.
Hi, Karen. That's a great question. I'm happy to hear you had your first dose. Colorado is prioritizing second doses for people who have first doses. So right now we have not had any issues with the supply of getting folks their second doses who have already had their first dose. If there were to be a supply issue, we would prioritize those second doses. So I would recommend that you do get your second dose at the location where you received your first dose, and that you coordinate with them on scheduling your second dose. You should not have to go through the queue and register and do all the things you needed to do to get the first dose, because all of our providers are very much aware that you need both doses in order to achieve full protection against COVID-19. And so we want to make sure, we do want to encourage folks to go back to the same place where they got that first dose, but we don't anticipate right now that there will be any issues with supply for folks to get that second dose. Thank you.
All right, Meredith, this next question is coming your way. It's MJ from Westminster who joins us on the line. Welcome to the call, MJ. Go ahead with your question.
Yes, hi, thank you. My question is regarding two of my friends who are a couple, and they're both over the age of 80. One of them is almost 85, the other one 82, I believe. And they both, they have Medicare through Kaiser, and they enrolled themselves back on January 11 with Kaiser, even though one would assume that Kaiser would have a record of their members and their ages, but despite that, they enrolled with Kaiser. Ever since they haven't heard back, they followed up last week. They told them that they would call them back pretty soon, but still they haven't heard from them. I wonder why these people are still have not received their vaccine. Thank you.
Yes, thank you, MJ, for that question. I'm sorry to hear that your friends are waiting on those lists. Unfortunately, the vaccine supply is very limited right now, and so all of our vaccine providers, including Kaiser, are administering the vaccine to people as soon as they receive it. But we are very limited by the small amounts of vaccine that we're receiving. There are just more people that are eligible and excited to get the vaccine than there are doses of the vaccine. So I can assure you that all of our providers are still prioritizing those groups over 70, and that if your friends are on a list, they will receive their vaccine. It's just taking some time to get through all of the eligible and interested folks with the limited supply that we have. Thank you.
All right, next we've got Diane from Littleton joining us with a question that's going to you again, Meredith. Diane, welcome. What's your question?
Are you talking to me?
Yes, ma'am.
Okay. My question is, even though, let's see, I am 78 years old. I'm very eligible for the vaccine. But it seems very difficult for me to get messages from my doctor about where to go or when to go or whatever. I'm like 4 blocks from Littleton Hospital. I went over there today to see what's going on there. And they were giving the vaccine for dozens of people that were like 20 and 30 and 40 years old. I don't know what occupation they were. Nobody told me. But it astounded me that they made me wait and said that I could maybe get one next week. I need to wait another week in spite of the fact that I should already have the vaccine. Why is it so hard to schedule where I'm supposed to go to get it? I've been told I need to look online or something like that. I mean, it's so frustrating.
Yeah, thank you, Diane. I understand the level of frustration we're hearing from lots of folks. I know it's frustrating. I will tell you that regarding folks that you might have seen who looked a lot younger, all of our vaccine providers are very strictly following the vaccine phases. And so we know that healthcare workers were, at the top of our list, and we're still working through those healthcare workers in Adams, Arapahoe, and Douglas counties, as well as vaccinating our folks over 70. I would continue to work with your healthcare provider. If you go to our website, tchj.org, there are links there that will help you navigate to the places where you can set up, get on a list to be scheduled an appointment. Unfortunately, just with that limited quantity of vaccine that we have in the state, we're just working to get it out as quickly as possible to all of those eligible groups. And being over 70, your vaccination is still the highest priority we're very much prioritizing those groups over 70 years old, even with this rollout of the new phases. And so I can assure you that these, our providers are working as hard as they can to get through all of our eligible folks as quickly as possible. Thank you.
All right, Meredith, thank you. We're going to throw another one at you. We got Sandy joining us from Arapahoe County. Sandy, welcome to the call. What is your question?
Hi, my son, who's 30 years old, has cystic fibrosis, which is a fatal lung disease. I am an educator, and I am scheduled to get my vaccine before him. Why is it that he is not scheduled to get his vaccine first, since he has a lung disease that would, COVID could very well kill him tomorrow if he got it?
Thank you, Sandy, for that question. The state is using statistics to show us who is most at risk of getting very sick or dying from COVID-19. And while we know that there are certain medical conditions that put people at higher risk, we also know that people over 70 are at much higher risk. And so that is the group that the state has decided to prioritize first, and then have used those statistics as well to determine future phases. So the most recently updated phases have the information on groups that will be prioritized later on, but right now the state guidance is based on the information that we have for folks that are most at risk for COVID-19, including those 70 plus and those healthcare workers and moving on down the line. So I understand your frustration and confusion, and certainly as more evidence and statistics come in, there may be changes to the phases later on, but the state is using the best available data to make these choices. Thank you.
Thank you very much, Meredith. And we've got another caller here. We've got Deborah from Adams County joining us with a question for Dr. Albanese. Deborah, go ahead with your question, please.
Good evening, everyone. I am on the Kaiser wait list and eligible for phase 2. I was wondering, what is the foreseeable timeline when phase 2 would become open?
Okay, Deborah, yep, thanks for your question. So I think Meredith and I have made it pretty clear on how things have been set up with the state of Colorado and the prioritization groups. We've been talking about it all evening, and that our limited vaccine supply is really what's driving how quickly we can get through these phases. So I hope that's just something that people can just understand, and we are doing our best. If vaccine supply markedly improves, whether that be through more vaccines being manufactured from the approved ones, whether that's more vaccines moving through the FDA process and being, approved for use for the pandemic. Those are all things that are going to change our vaccine supply, make it better, and it could accelerate things. So for the phase 2, which is people age 60 to 64, people with high-risk conditions that weren't already addressed in the phase above them, 1.1B3, and then, for essential workers in government. We're anticipating sometime in the spring. Again, that's an estimate. We hope that will get accelerated as vaccine becomes more available. And I am going to just take a little prerogative to just give you guys one other phone number. We've heard a lot about people getting challenges with trying to make appointments, maybe challenges because computers are not your thing. But they're, in addition to calling to Tri-County, who can help you navigate the systems of the health systems that are offering vaccine. The Colorado Health Department also has a number that you can call, and they can also give you some direct assistance with making an appointment. That's not something Tri-County can do because we're not integrated into those systems, but there's another number that you can try to see if they can walk you through how to make an appointment directly, and that number is 1-877-268-2926. That's 877-268-2926, and that's with the State Health Department and the Governor's Office to help directly as well making appointments. Thank you.
Thank you very much for that added information, Doctor. And it looks like we have time for just one more question. And we've got Tracy. Let's see here, and I apologize. We need to move forward. Yes, Tracy in Douglas County, and a good question for Meredith with Tri-County Health. Tracy, welcome.
Yes.
What's your question?
Thank you. Good evening. I was wondering if you have any instruction for small child care center employees who have yet to be given any direction from their employers about setting up vaccinations. Can each employee with proof of employment go to any site that's vaccinating, or is there particular sites where individual employees can go as opposed to going with a group of, say, a larger center or a large school district who has those resources to set up those types of vaccine appointments all at once? I just would like to try to get on a list, if possible, while I'm waiting to hear from my employer.
Of course. Thank you, Tracy. We at Tri-County Health Department are working with the vaccine providers to determine the capacity in the community for those providers to start working with schools and child cares. And so we are working at the employer level to make those arrangements and to match those groups, to provide those groups with information on where they can be vaccinated. At this time, many of our providers are still working to vaccinate those 70 plus and healthcare workers, and so they may not have appointments immediately available for our teachers or child care workers. And so that's why we do want you to work through your employer so that they can sort of coordinate with Tri-County, discuss those options with us, and we can communicate that out via some of our emails, our websites. And I would add, based on our earlier question as well, that our pre-K through 12 educators are so essential to getting our essential workers at work by having children in school. It's also really important for equity that those educators are in school and our essential workers are not providing childcare at home. And so we want to make it as smooth as possible for those educators and child care workers to be vaccinated, and we're actively working on that at Tri-County. So please give us a call if you're, or have your employer give us a call if you need more information. And we'll continue to post those opportunities on our website and through our communications to our partners. Thank you.
Wow, we have covered a lot of ground tonight, and our time is almost up. I'd like to turn things over now to commissioners for some closing remarks. Let's start with the Arapahoe County Commissioner, Nancy Jackson.
Thank you. I hope you can hear me this time.
Yes, ma'am, we can.
Wonderful. We had some technical difficulties, which are frustrating, but not nearly as frustrating as the folks that we heard from tonight. We really understand how frustrating and at times even scary to not get your questions answered. So hopefully we answered some of your questions and provided you with some phone numbers or websites. So we have over 15,000 people on this call, so we couldn't get to everybody, but hopefully some of your questions have been answered. We want to thank you all for joining us tonight, and we want to thank our guests for providing the invaluable information. We hope we've been able to clarify some questions and concerns you have, and we urge everybody to review and follow the guidelines closely. Stay safe and healthy this winter by continuing to take the necessary steps to protect yourselves and your families. And now, Commissioner Thomas.
Thank you, Commissioner Jackson. I'd like to echo many of the comments made by a fellow Commissioner, Nancy, just now. She really talked about hearing the frustration and the concern in all of your voices. And we share those concerns in Douglas County. Only 43.4% of our 70-plus people have been able to get their first vaccine. So the commissioners know very well what the problem is, and we're doing all we can in partnership with Tri-County to get more vaccine available for all of you. We'd all like to get back to normal as quickly as possible in 2021, and we deeply appreciate everyone's cooperation and understanding as we head into the home stretch here in this battle against COVID. Thank you again, and I'll turn it back over to our moderator.
Thank you, everyone, for joining us for this important call. As a reminder, we'll post a copy of this recording to our website in the next 24 hours. We hope you stay safe and healthy, and have a great night.